Assalamu alaikum. Welcome back to Dr. Tariq RYK. Today our topic is about the bones of the upper limb. Upper limb bones anatomy. We will discuss each and every bone of the upper limb separately, and we will discuss each and every clinical point on the every bones. And let's start our topic. If you are new on our channel, start subscribing our channel and on the bell notification for upcoming new videos on the medical. This is the overview of the upper limb. Here is anterior arrangement of the upper limb. Here is a posterior arrangement or posterior view of the upper limb. Here is the lateral side, lateral view, and here is the medial side or medial view. Here is superior. If you see from upside or cranial side to the caudal, upper limb will be like this. If you see inferiorly from the caudal to cranial, upper limb will be like this. This is the anatomical position of the upper limb. This is again anterior. Today we will discuss about the radius. Radius basically is the bone of the forearm. Radius is the bone of the forearm. Radius. Here is the radius. This is the long bone. Has a shaft, proximal and distal part. Here is. We will discuss each and every point on the radius. This is the anterior of the radius. We start from the proximal to distal. Here is the articular fovea of the radius that attach with the capitulum of the humerus. And here is head of the radius. Here is neck of the radius. Here is the radial tuberosity. Radial tuberosity here. And here is the anterior border or shaft border of the radius. And here is the anterior surface. This is shaft, and we will note about the distal part. Here is sacrificed bone attached with the this part of the radius. This is the articular surface of the radius. Radius of the for the sacrificed bone of the wrist or the carpal bones. This is the styloid process of the radius. Styloid process of the radius present in the lateral side, but styloid process of the ulna present in the medial side. Here is again carpal articular surface of the radius for the sacrificed and also for the lunate. It has a short part for the lunate and also for the sacrificed. This is the anterior view of the radius, and see this is the posterior view of the radius. Posteriorly radius will be like this. Here is from proximal to distal. Again this is the articular fovea, and here is the shaft of the radius. This is shaft of the radius. This is long bone, and here is the posterior surface of the radius. We are viewing the posterior view. Here is a posterior border. Here is a this is the dorsal tubercle, or also known as the lister tubercle of the radius. The dorsal tubercle of the radius also known as the lister tubercle. And here is the styloid process in the distal part. This is the posterior view. If we see the lateral view radius will be like this. This is the lateral surface, and here will be the posteriorly. Laterally in the distal will be the styloid process of the radius. This is the lateral view of the radius. Next, see the medial view of the radius. Here is the medially, the medial part, the medial surface of the radius joined with the ulna in the syndesmosis joint. From proximal, we will see here. This is the articular fovea head of the radius that attach with the capitulum of the humerus in the elbow joint. Here. This is the radial tuberosity that attach with the ulna, and here is the head of the radius, and here is the below the head is the neck of the radius. Here in the shaft we will see this is the anterior border laterally, and here is anterior surface. This is interosseous border. This is the medial border of the radius that are attached with the interosseous border of the ulna by the syndesmosis membrane or interosseous membrane that make the syndesmosis joint. And here is distally, here is the ulnar notch for the this is ulnar notch for the head of the ulna. In this the radius has ulnar notch. In this which the ulnar head will be articulate in the distal radioulnar joint. And here is a circular process, and this is the and with the circular process, this is the carpal articular surface of the radius for the sacrified bone. And here is another articular surface. This is the articular surface for the lunate. This is more medial, and this is the lateral surface articular surface for the scaphoid, and the medial articular surface will be for the lunate, because lunate is more medial than the scaphoid. Scaphoid is the more lateral. This is the medial view. Then we see superior view of the radius. Superiorly ulnar radius will be like this. Superiorly radius will be like this. We will see the fovea, head of the radius. Here is the head, and here with the head here is the neck. And this we will be seeing this is shaft or body of the radius, and here is lateral surface. Here is styloid process in the superior view. If we see from the inferior view, this is the inferior view of the radius. Inferiorly we will see the articular surface. The radius has two articular surface for the carpal bones. This is the medial articular surface on the distal part of the radius for the lunate bone, and here is another articular surface. This is present the medially for the laterally known. This is the articular surface for the sacrified bone. Two carpal bones articulate with the radius in the rest joint. This is the distal surface. Again see, this is the lateral articular surface for the scaphoid, and it is medial articular surface for the lunate bones. And here is ulnar notch. Ulnar notch is adjacent to the or medial to the lunate articular surface of the radius, and in the ulnar notch the ulnar head will be attached with here, because ulna has head in the distal part that attached with the distal ulnar notch of the radius. And here is again dorsal tubercle, that also known as the distal tubercle, and here is a styloid process of the radius. This is the inferior view of the radius. Then again see from the anterior view of the radius. This is the radius. Anterior view you see it is like this: fovea, head of the radius, neck of the radius. This is the radial tuberosity. Here is the shaft of the radius, anterior border. This is the anterior surface. This is the lateral border, and here is again in the distal part will be the ulnar notch. These are the styloid process. This is the styloid process here, and adjacent to styloid process or medial to styloid process, here is the articular surface of the radius for the sacrified, and with it is the articular surface for the lunate carpal bones. And this is the posterior view. See posterior surface, posterior border. Here is the posterior surface, and here is the posterior border, and here is the articular fovea for the capitulum of the humerus in the elbow joint. And in the distal, here is the dorsal or lister tubercle, and here is a stellar process of the radius, that is the more lateral part. So this is the overview or whole about the radius. I hope you will be understand about this. If you have any question, any query, make comment and I will be help for you. Thank you for watching. See you for next. Allah.